Welcome to The Explainer. Today, we're diving into a fascinating medical puzzle, a drug that works by pushing a body system so hard, it actually forces it to shut down completely. I know, it sounds totally backward, but it's a real game changer in modern medicine.
The drug we're talking about is called Leuprolide. And yeah, it's a synthetic hormone that works in this completely counterintuitive way. But to really get how it breaks all the rules, we first have to understand the system it's designed to manipulate.
So, before we see how Leuprolide just comes in and smashes the rules, let's take a quick look at how the body's natural hormone communication system is supposed to work. Okay, so think of your body's reproductive hormone system, the HPG axis, as a really carefully regulated thermostat. Your brain, specifically the hypothalamus, sends out these little rhythmic pulses of a hormone called GnRH. These pulses are like tiny, perfectly timed signals that tell the pituitary gland what to do, which then controls all your testosterone and estrogen production. The key word here is pulses. It's a delicate on-again, off-again conversation.
All right, so that's the normal rhythm. Now, let's see what happens when Leuprolide hijacks this system. Instead of those gentle pulses, it unleashes a constant, overwhelming scream of a signal.
So here's how Leuprolide pulls off its wild, paradoxical trick. At first, it acts like a superstimulant, right? It causes this massive initial hormone flare. But here's the twist. Its signal is constant. It never shuts off, unlike the body's natural rhythm. This continuous shouting completely overwhelms the pituitary gland. The receptors, which are used to those gentle pulses, they basically get exhausted. They throw their hands up and retreat from the cell's surface. And this leads to a total system shutdown. The production of testosterone and estrogen just plummets.
And this process actually has a name. It's called downregulation. It is the biological key that solves our paradox. By essentially shouting at the pituitary gland nonstop, Leuprolide forces the gland to plug its ears until it just can't hear the signals at all. It becomes deaf to the command.
So the bottom line is this. By jamming the system wide open with a constant signal, Leuprolide forces the body to slam it shut completely. We're talking about dropping testosterone or estrogen levels to almost nothing.
It's a pretty dramatic effect. So you're probably thinking, why on earth would we ever want to do that? Well, it turns out to be incredibly useful. This powerful hormone shutdown becomes a crucial tool for treating a whole range of conditions. We're talking about hormone-sensitive cancers like prostate and breast cancer, really painful chronic conditions like endometriosis, and even stopping puberty that starts way too early in kids.
Probably its most common use is as a cornerstone of hormone therapy for advanced prostate cancer. You see, many of these tumors rely on testosterone as fuel to grow. So by cutting off their fuel supply, you can actually shrink the tumor and slow the disease way down. It's also a huge help for conditions like endometriosis, where estrogen fuels the growth of this painful tissue outside the uterus. Leuprolide basically creates a temporary and, importantly, reversible menopause. This stops the menstrual cycle, shrinks that rogue tissue, and gives people significant relief from chronic pain. Now, you might be wondering, why can't you just take it as a pill? Well, because Leuprolide is a peptide. It's basically a small protein. Your digestive system would just chew it up and destroy it. That's why it's given as a long-acting depot injection. This slowly releases the drug over 1, 3, or even 6 months, making sure that constant suppressive signal we talked about is always there. But, as you can probably imagine, shutting down a major hormone axis like this, well, it doesn't come without consequences. There's definitely a price for hitting the pause button that hard. And the logic here is pretty straightforward. The side effects you're going to experience are the exact symptoms you would expect from having very, very low levels of testosterone or estrogen in your body. It's not a mystery. It's a direct result of the drug doing its job. So for men, this means the classic symptoms of low testosterone, things like hot flashes, fatigue, loss of libido. For women, the drug is basically flipping the switch on a temporary medical menopause, bringing on all the symptoms that go with it. And a really key concern for both is that long-term use can thin out your bones, which increases the risk of osteoporosis. And hey, remember that initial hormone surge we talked about, that flare? Well, for the first couple of weeks, that can actually make symptoms worse. For example, a man with prostate cancer might get a flare-up of bone pain. Doctors know this, so they often manage it by prescribing another drug for a few weeks to block the hormone's effects during that initial period. Okay, so let's pull this all together. What are the key takeaways for anyone who might be considering this kind of therapy? Look, the power of Leuprolide means it has to be managed really carefully.
Because it affects the whole body, bone health is a big deal and needs to be monitored, especially if you're on it for a long time. It can also mess with your metabolism and cardiovascular risk. And it goes without saying, it's an absolute no-go if you're pregnant. This is a serious intervention, you know. It's reserved for when a diagnosis is 100% certain.
Ultimately, Leuprolide really represents this fascinating balance in medicine. It is such a powerful tool that works through a biological paradox, and it offers profound benefits for some really serious conditions. But those benefits come with significant trade-offs. And that leaves us with the critical question for every single patient. When is the hormonal pause worth the price?